Okay, good evening, everyone. Thank you for joining our discussion for our topic MRD 538, 568 excitement, MRI technique, and also the protocols. As we already know that our group we got our topic on MRI neck and also MRI spines. So for the today meetings, it's mainly to discuss our planning, our task distributions, and also any ideas for the presentation contents based on the assignment guidelines they've given by our lecturer. We need to cover all the introduction, anatomy, clinical indication, patient preparation and care, RF quest selection and patient positioning, and also the most critical part is the MRI protocol, and also the last part is for the MRI artifact. We also in this assignment we also need to demonstrate the good teamwork, communication, and also leadership, because we got the mark for the communication, we got the mark for the leadership discussion throughout the preparation process. So first, both of you, Nazira and also Ilman, what do you think about the topic we've chosen for this assignment?
Hi everyone, good evening. So as we know, our topic is about MRI neck and spine. It is a good topic because of usually the MRI spine is really quite familiar with us because of MRI neck and spine is easy to what like that lah. So it has many important clinical applications. So as we know, MRI neck and spine got many sequence, right? So we should explain clearly, and then the MRI neck and spine is quite broad, so we should more specific what kind of anatomy, what kind of pathology indicates to the MRI neck and spine, right?
Yeah.
Yes, I agree. Especially for spine imaging, because it includes cervical, thoracic, and lumbar regions. So we have to make sure that our presentation is systematic and not too confusing. I mean, it can be compact, but it is very specific and systematic. So it will be good, and people can understand our presentation.
Okay, I agree with both of you. Since this topic is too large, I think we should divide the presentation into the section for the each team member, so we can focus our own parts properly. I already reviewed the rubric they given by our lecturer, and so it's very important for us to participate. So we should distribute the task fairly. How, Nazira?
Yeah, that's a good idea. So we should divide three offers fairly and according to the assignment section lah.
Yes, alright. For the introduction and also anatomy, I think Ilman should take this part because you can explain the anatomy clearly and also confidentially. Ilman?
Alright, I can do that. So I will focus on the overview of the neck and spine, normal anatomy, also covers the normal anatomy, and I will also provide MRI images.
Yeah, this sounds good. I think Nazira, maybe you can handle the part of the clinical indication and also the patient preparation. Did involve the patient care and safety. Maybe you can go through the ACR guidelines, for the patient preparation and also the contrast administrations. Nazira, you okay with it?
Yeah, it's a good idea. Of course, I'm okay with that. So I will cover about the pathology, examples, symptom, and then the most important is patient preparation, right?
Mm.
Contraindication. There are
Yes,
there
yes.
are yeah there are guideline currently guideline yang madam gave us to study about the guideline, the latest guideline. So I should study first about that. Okay.
Yeah.
Mm-hmm.
Then for the critical parts, MRI protocol and scanning parameters, and also the rationale for the protocols, and lastly the image artifact. I will handle about it. And also I also coordinate the slide arrangement and so the overall flow of our presentations. Yeah.
Okay. I think it is a good divided. Oh, wait. What about the themes of the presentation? What the themes of the slide? Because I love to have a flower
Yeah,
of
this sounds good.
the all of this.
Yes, yes, this sounds good. Since
Mm.
this one is our formal academic
Oh
presentation,
yeah.
maybe you can use the clean and also the professional with the
Yeah.
designs of the MRI images and diagrams. We can give to the animation also, and also the
Yeah.
decorations, because this one to attract our audience. Yeah,
Yeah.
Hilman,
We
you
should
agree
start.
with it?
Yes, I agree. I think we should focus more on clear explanations and also the image quality. Because with the image quality is good, so that our spectators can understand what are we trying to present. I mean, they can clearly understand the indications and also, I mean, they can differentiate between the images, the quality of the image.
Mm.
Yes, yes, correct. Because another important things we need to know about our reference for the MRI images and for the MRI protocol. So we need to taken from our center for the a working place for Nadi, especially for my parts MRI protocols, and also Nazira for the how the contrast study for the MRI contrast study. Yes.
Yeah. We should highlight the part that part. Okay.
Maybe Ilman, you can add more points about the anatomy and also the pathology images.
Mm, I just want to suggest that maybe we should use recent references for the MRI protocols and safety guidelines.
Okay, this good friend. One more thing is for the communication, the representation, that we should avoid reading directly from the slide. We need to explain it naturally, and because communication skill is a part of the assessment rubric that given by our lecturer. And Zira.
Yeah, we should practice about our so it make us smooth, okay, our transitions, our pass over the part by part should be smooth and clearly, can.
Yes, yes,
Yes,
I agree
I
with
think
you.
we should do at least one rehearsal or practice maybe before the presentation day,
Mm.
so we
Yeah.
can be ready.
Yes, yes, definitely. After everyone complete the slides, maybe we can arrange the rehearsal, another discussion, to review our slide so that our presentation flow moves smoothly. And before we end our discussion, does anyone any problem or you any suggestions that you can give for regarding our assignment?
So far, no, don't have problem. But Gilbert should try to you create we use the Canva, right?
Yes, you use the Canva.
Yeah.
Yeah, yeah.
Then you create the Canva first, and then we do our part, lah.
Yeah,
Okay.
yeah. I will share the links with you in the WhatsApp group, Hilman.
Okay.
Yeah, yeah. All right. Ilman, anything you want to add on?
Okay, for my part, maybe I will begin searching for some clinical indications and maybe patient preparation information. So, yeah.
Okay, alright. Thank you everyone for your cooperation.
Okay.
Okay, and please update us progress in our WhatsApp group regularly so we can monitor each other for the timeline. I hope we can work together effectively and we can have a good presentation during the day. Thank you everyone.
Okay. Thank
Thank you,
you.
guys.
Okay, good evening everyone. Thank you for joining our today's second discussion regarding our assignment MRD 538 magnetic resonance imaging technique and also the protocols. So, since our last discussion, we have already finalized the topic and completed most of our presentation slides. Thank you everyone. Today's discussion is mainly to confirm our content accuracy, our presentation flow, our preparation. It's more to the preparation before the actual day of the presentation. I also want everyone to focus on the communication styles, transition between the presenter, and also Q&A preparation, so that we can meet the rubric that requirement for the leadership and also the communication skill. Before we begin, does everyone agree with our current structure of the presentations? Nazira and Ilman?
Yeah, it's quite good, simple but nice. Clear, so everyone can see it's clear without disturbing the unnecessary informations.
Okay, good. So Ilman, how about Hilman?
I agree as well because the MRI images and diagrams are suitable for explaining both normal and abnormal anatomy. I think our content already follows the assignment guideline clearly. Maybe today we can focus more on how each member explains their part confidently and make the transitions clear or smoother.
Okay, alright, thank you Ilman. I think based on the guideline, communication and leadership assessment will focus on our clarity, our teamwork, confidence, coordination during our presentation and also the Q&A. So I want everyone to confirm their session, explain if there is any problem, so that any part that still need the improvement. Ilman, can you start with your session first? The introduction and also the anatomy.
So for my part is the introduction and anatomy. For the introduction, I will explain the overview of the neck and spine, including the compartments of the neck and the role of MRI in assessing soft tissue, nerve structures, inflammation, and tumors. Then for the anatomy, I will explain the normal MRI appearance using Excel 1, E2 and sagittal images. After that, I will continue with abnormal anatomy, including tonsillar tumor, laryngeal tumor, subglottic tumor, and spinal cord inflammation. I think my challenge presenting to this part is for remembering all the anatomical labels during presentation. So maybe I will practice more with the MRI images.
Okay, that sounds good. Focus more to the explaining the image naturally and confidently, and you need to have the audience engagement. Okay. So good. Nazira, can you continue with your section for the patient preparation?
Yeah, for my can you move the slide? Can mind?
Yeah.
Can you move the slide?
Oh, sorry. Yeah. Was the
That one is your part, anatomy.
Anatomy
kan?
is Hilman part, yeah.
yeah.
This one is about common clinical indication and patient preparations. So, the MRI necks and spine, they are broad, right? There are many of indicate for the MRI. So, but we should focus on. I will explain the lymphoma, epidemic cyst, metastasis, spinal cord, and about the compressions, including the symptoms and MRI appearance in T1, T2, and stir image. So the patient preparation, I will explain the before, during, and after. So this one is very important, right? Because of once we don't proper prepare the patients, so we cannot do the examination. So we have to highlight the patient preparations. Okay, another one, I have I've done review the apa that one
ACR guideline, yeah, ACR guideline, right?
ACR guideline. So there are some explanations about the preparation, about the MRI safety if the patients have a EGFR more than 30 GFR, right? So I will put the informations on the slides. And commonly about the claustrophobia patients, so contraindication, that one I will explain and put on my slide. So I think my slide is complete now.
Yes.
You guys can see if got anything to be added. So far, I think that one is.
Yeah, so far is good. Yeah, so far good. Okay, thank you, Nazira.
Okay.
Because your part is very important. Because
Yeah.
it involve the patient safety actually. So during the presentation, you need to explain more about how the patient safety after, before, during MRI, and also the contrast administrations. So for my part, for my section, can you move to my slides for the MRI protocols? Ilman, you can move to my slides for the MRI protocols. Okay, this is Nazira part, contrast media, RF protocols on Nazira part. This is my part for the standard and also the additional protocol. I will cover for the MRI neck routine, soft tissue, prosthesis space. These protocols I got from the CTC Sungai Buloh. For the standard and also the additional sequence, we'll cover this one. And next slide.
This one based on your hospital guidelines.
Yes, based on my hospital guidelines, because mostly our protocol we got from the HKL. Yeah, we follow the HKL protocols. Yeah, and I will explain why the rationales of the protocol that been used, such as why TR is short, why TE is long, why the and also post contrast. I will explain also about the parameters TR, TE, TI, flip angle, FOB, and also the next metric. And I will explain also why that scanning is used for that sequence. This is most important. Okay. Wait, and then and the last one, I will explain about the artifacts. As you know, our rubric, we need to explain one artifacts. That's artifact, including the causes of that artifact, the appearance of the image appearance of the artifact, and also what method should be used to reduce these artifacts. Okay, so Nazira.
I think your section is about the technical part, that everything is about the scanning parameters. Because of why we choose you, you are the chosen one, because of from both of no, the rest of us, you are the one who handle the MRI machine, MRI patient. So I think you are the most experienced with the patients in MRI examination. So
It's
you can,
okay. It's
you
okay.
can,
It's okay. We will
go ahead.
study slowly.
Yeah, you can
Yeah.
explain perfectly, I think.
So Ilman, how do you think? Because I think I will plan to explain the parameter in the simple lah. Because for example, why the long TR and TE will increase in the T2 images. For the stir also, why it used to suppress the fat, and for the DWI, why it used to detect any tumor and also the infection. I think it's very simple explanation that everyone can understand. Yeah.
But wait, how DWI helps to detect the tumor and infections? If I am
This one I will explain later during the presentation. This one I will explain later.
okay,
Because
okay,
this,
sound weird.
yeah, because DWI, I will explain to you what is DWI, what is ADC, what is SWI. Because this
I
one we
see.
use different terms, different anatomy that we can detect, and different image appearance. Okay.
Yeah, sure.
So Ilman,
I just think that we should our transitions between presenters should be smooth. Right now, sometimes it feels too sudden, so maybe we can improvise on that.
yeah. It's very good point for Iman, because the session before we finish the transition, we need to, okay, that's all from me. For example, I will pass to the next presenter Ilman for the next part, and also before we start the presentation, thank you Ilman. We need the clear communication to the presenter. Yeah. Azira.
For the introducing our teams, I should. Can I do that part?
Yeah, can you can take that part to introduce the team members.
Also, I will bring the laser.
Yeah.
So we can use the laser.
Yeah. That sounds good. Yeah. So Ilman, any point that you can add on?
Maybe we should also prepare some possible questions and answers together, just a few maybe.
Yes,
Yeah.
definitely, because we got the mark for the Q&A also, right? So the answer, because this one is our individual mark, so we just don't stress, just doing our best for answering the question. Yeah, this is more important.
So we should prepare the question from our part lah. So how many questions we should prepare? Should be 3 questions?
Yeah, maybe 1 to 5. 1 to 5 questions. 3 to 5 should be okay lah. Should be enough. Okay. Yes, after this meeting, each member we should rehearsal individually. Then maybe tomorrow or one day before the presentation, we can do the full rehearsal together. Yeah, to double checks our pronunciation, our MRI terminology, and also the pathology names. Okay.
Yeah. Alright. So I will definitely advise the explanation.
Yeah. We should find the suitable dates to our rehearsals. But just I have a possible questions. Why, if they are asked, MRI preferred for neck soft tissue evaluation? Why? Why, man?
I think the question is more to the protocols, why we choose that protocol and why we choose that protocol for that type of the pathology. And then I think question is regarding the why we choose that coil for that type of the examination. I think more the question, and also the, because as we know, right, the preparation for the MRI almost the same. So what to differentiates our preparation that difference from other MRI protocols? Yeah. Hilman, any point you want to add on? Any point, Ilman, and also Nazira, you want to add on?
So in my slide, I ada letak macam the patient, some of the preparation is patient must be avoid in the swallowing during scanning. Because we should, because of we want to reduce the motion artifacts, right?
Yes, this is more important because some clue, there's some clue
The
question.
artifacts, you will cover the artifacts part, right?
Yes, the artifact I will cover, but I only explain one artifacts. Because the rubric say I will explain the one artifacts.
Okay.
So, any point you want to add on, Ilman?
Okay, maybe just one point, because like Madam said, that our presentation is for 40 minutes only, so maybe the practice we should also be mindful of the timing of the presentation.
Yes.
For 40 minutes.
Yes. So I think we need to
40 minutes including or exclude the Q&A, apa tu, Q&A section?
exclude. Actually, for the presentation in Q&A, if 50 minutes, but 10 minutes is for Q&A session and 40 minutes is for presentation. So overall, I think our progress is good. Our content is already follow the assignment guideline. But thank you everyone for your cooperation and also commitment. If there is no issue, if the issue, okay, Nazira, anything you want to add on?
What color we should wear?
Oh, our outfit. Okay.
Should we
It's follow
wear
all.
the same color?
Yeah, I follow all of you.
I think blue is good, right?
Yeah, good.
Light
Okay.
blue, light blue.
Can. Blue, no problem.
Okay.
Alright. Thank you everyone.
Okay, thank you everyone.
Alright.
Nice.
Have a nice day.